Hello, my name is Jeremy with Faithful Guardian Training Center, and today we're going to be talking about shock. Specifically, we're going to be talking about psychogenic shock, which is a form of distributive shock which causes vasodilation. So, psychogenic shock is a sudden reaction of your nervous system that produces temporary vascular dilation, and this can result in syncope or near fainting, and where syncope is fainting or passing out. So what happens is there's a catecholamine release that causes vasodilation, and what happens is blood starts beginning to pool in your new dilated vessels in your temporary state of relative hypovolemia. And what this causes is this reduces cerebral blood flow. And with it reducing the cerebral blood flow, this is going to cause your brain to not be able to function, so it attempts to go to reset, and the way that it resets is by passing out. Now, whenever you pass out, you're going to end up supine, or maybe laying just a little bit in a way where you're actually going to have blood flow return to your brain. And so in this case, whenever that happens, whenever you have the blood flow return to the brain, from that point, your body's going to wake back up, and you're going to wake up and maybe not know what was going on. So there's a couple different causes of psychogenic shock. There's an irregular heartbeat, which is why anybody who does have a syncopatic episode, they need to be put on a cardiac monitor and have a 12 lead performed. You can also have an aneurysm, which the way that we can test for that in the field is going to be check a blood pressure in their left arm and their right arm. If they have a substantial gap between their systolic blood pressures, then that could lead you to suspect that it could be an aneurysm. You also have fear. Some people, whenever they get in a situation that causes them to experience fear, they actually pass out or go unresponsive. A lot of people compare psychogenic shock to the fainting goats, where if you go up and you say, and you scare them, from that point the goat just kind of falls over. It's very similar. And then you also have those folks that pass out at the sight of blood, or any other substance, any other unpleasant signs, substances or smells, anything that could cause a stimulus. So again, the cause is irregular heartbeat, aneurysms, fear, or even unsightly sounds or sights. Now, always assess for trauma in these patients who do pass out and do hit their head or hit their back or fall. Reason being is because if they passed out and they hit their head and they have a cervical injury and you're not suspecting it, well, then your patient may end up developing into a case of neurogenic shock or some other type of injury based off of that information. You always want to try to question bystanders as much as possible to obtain as much information about the event leading up to the event. Was your patient experiencing anything? Were they saying they felt weird? Was there anything going on in the environment? And how long did they pass out for? How long were they unresponsive for? Did they fall? Did they hit their head on something? Did they hit their head on a table? Did they fall on grass? Did they fall on concrete? These are all things that you can use to kind of help guide your treatments. And another thing you can do is obtain orthostatic vital signs, which is where you take blood pressure and a heart rate while you have somebody who is supine or laying down. You take their blood pressure and their heart rate again whenever they are sitting up, and then you take their blood pressure and the heart rate again while they're standing. And so what this does is this kind of shows you if your body is actually compensating for what you're doing or not. And so if you have somebody who has a drop in their systolic blood pressure of greater than 15, then they can fail that orthostatic vital sign test or that tilt test. And if you have somebody whose heart rate rises more than 20 points, then they also fail. And if you have somebody who gets dizzy upon sitting or upon standing, then they've already failed the test, and you know that their body is not compensating for whatever issue it is that they have going on. could be dehydration. It could be a cardiac issue where they're having diminished cardiac output due to some other ailment. There's a lot of stuff to go into this, so you need to do a complete and thorough patient assessment, including 12-lead cardiac monitor, trauma assessment, and a tilt test or that orthostatic vital signs. And again, psychogenic shock, a sudden reaction that causes widespread vasodilation. You have pooling in the dilated vessels, and which reduces the cerebral blood flow. The causes could be an irregular heartbeat, an aneurysm, fear, sites of blood, or any other substance like that. And always check for trauma. Do a tilt test or that orthostatic vital sign test, and try to question the bystanders. And that's psychogenic shock.